I'm a hair mineral analysis expert. I have a background in functional medicine, and I educate people using HTMA testing to maximize health, erase debilitating symptoms, and gain energy. I'm a multi-time kettlebell sport world champion, and I'm constantly searching for high-performance pros from all over the world to bring you this human optimization podcast. My name is Lisa Pitel-Killah. Hello, everyone, and welcome to a brand new episode of the Human Optimization Podcast. I am so excited today to have here with us Dr. Michael DeCubellis. He is a leading expert in treating complex and chronic injury cases. He's had multiple clinics and currently practices in Downers Grove and helps others understand the why and how of lasting pain and the healing process, which is so important. Dr. DeCubellis came across this area after having several patients come into his clinic with pain that had been present for years and never went away. He wasn't able to make much progress with these patients either, and he wanted to figure out why this was happening and what could be done about it. After extensive training and research, Dr. DeCubellis was also able to identify the underlying problem with the way of treating these patients, identify the underlying diagnosis, and create a specialized treatment protocol to achieve results that were not possible before. Now those patients with injuries are able to heal properly for the first time, and the recurrent and chronic problems actually improved, which is great. This was made as a way to better help patients get results quickly and not have these structural issues coming back. Now he works not only to help those achieve better results, but to help people understand what's going on in their bodies, how the healing really happens, and why issues become chronic. And so welcome.
Thank you. Thank you for having me.
Absolutely, my pleasure. And with regards to the experience and the research that you've done and the processes that have come up with, we're going to have some pretty in-depth conversations today, which is exciting. And I mean, really dealing with that healing journey, because again, when we talked earlier, you're right, a lot of people end up having those recurring issues where it keeps coming back and keeps coming back. And so give us a little background on your practice and tell us a little bit more about how you came into that unique experience and how you're using it for your clients today.
Yeah, sure. So when I first started, I was treating a lot of people with neck and back issues. And we get the people who, they come in, they just did something over the weekend, injured themselves, a very acute type injury.
Mm-hmm.
But then we started getting patients who had been dealing with issues for months or years, and it's been reoccurring. They told me, hey, I was diagnosed with XYZ a couple of years ago, and I feel like it's being re-aggravated. And what I was noticing is that the typical approaches to those types of patients was not yielding the results that I wanted. We were keeping them in that kind of vicious circle of they feel better for a little while and then it comes back, and then they get better for a little while and it comes back. But ultimately, at the end of the day, they keep ending up at a worse point than they were before. So I wanted to figure out why this is happening and what we could do to try to break that cycle and get better lasting results.
Amazing. And you're right, because, I think we've all had that happen where it's just something that kind of creeps back up on us. And so we are going to dive a little bit into this later on in the episode, but even with regards to myself with training, sometimes we're not always listening to our bodies too. So we're going to talk about that too. But the first topic I really would like to talk about, because I think it's affecting so many people working from home, is the mistakes they're using when they're using a laptop, right?
Yes.
I feel like a lot of us might be just sitting on the couch using our laptop, or maybe at a kitchen table where the chairs aren't quite the right height. So kind of give us your ideas about how to fix some of those issues that are happening and things that you're seeing with some of your clients.
Yeah, no problem. Well, the first thing that seems to happen, which is kind of interesting, is when people go from working in the office to working at home, they forget all about ergonomics. It's like, I'm at home, so I don't have to worry about, I'm not in that work environment, when they put so much time and effort making sure their workstation is ergonomically good for them and making sure they don't have issues. But that somehow goes out the window. I think part of that is because most people are used to working at home in very small increments. Mm-hmm. It wasn't their main place, but now that we're working 8 hours plus a day at home, ergonomics are huge. Now it's your home is your office. So the first thing that I see that it's almost the first question I ask when I have someone come in who has a new injury or a new pain is, are you working on a laptop? And they usually say yes. And then I say, okay, well, where are you sitting when you're working on your laptop? Usually it's the couch. That's number one.
That was number one for sure.
Number one's the couch.
Yeah.
So that, or they're working at like their counter table. Those things are made to be eating at, not made to be working at. And the reason for that is we have to go back to the ergonomics. So what's happening with the couch? We take the laptop, we put it right on our lap or on a pillow. And what are we doing with our head? We're doing this.
Yes.
And then our arms are going down and we're typing. So we're putting ourselves in an abnormal posture for multiple hours at a time, which is going to cause these repetitive stress type injuries. Or we do the reverse. We put it up too high and now we're reaching like this and we wonder why at the end of the day our shoulders are hurting. Mm-hmm. Well, you're using those muscles all day to do something that they're not made to be doing because they're compensating for the abnormal posture you put them in. So we just have to remember, let's set this up like we're going to be working here long term, because if nothing else, you're still going to be doing yourself a service by getting your workstation set up at home better. So that's really the whole thing, is just starting that way. And it all starts from where you need to have the center of the monitor. So if it's a laptop, that's fine. If it's a desktop, that's fine. But the way it should be set up is you want to have it to where the center of the monitor should be right even level with the center of your nose. Mm-hmm. So if it's too high or too low, you're causing problems in your neck.
Yeah.
That right there will solve a lot of the issues, but that's not the only thing, but that's the way to start. The problem is, here's the other problem. We've got where the screen is. The other problem is the laptop itself. If you're using that laptop keyboard, it is impossible for you to have the screen centered and your arms to be able to be at 90-degree angles, which is where you want to be ergonomically, and be able to work that way. It just doesn't happen. So the best thing is to get a wireless keyboard and mouse.
Yeah.
Those two things will solve probably about 90% of the things that pop up.
And you know what? I never thought about that before when you say that, because I mean, even so I work from a laptop, but I'm totally going to do that, is get a wireless mouse, because I never thought about that before with regards to the position in front of your face. And that makes absolute sense. Taking the time to do this now, I think, is the key to making sure that you don't have any longer term problems that you're dealing with regards to what you're actually doing right now.
Right.
So I want to talk a little bit about neck problems, because I know for me, and now I think it's probably from using my laptop all the time, is when it comes to neck problems, and the other one is phones, because I, even when I'm on my phone, I have to pay attention, like, oh my goodness, I need to, because your phone is odd. And when we're texting, we're always looking down. So tell us a little bit about that. Tell us about your suggestions and kind of what you're seeing with regards to that aspect of things.
Well, phones have really been a big proponent of pushing neck problems and neck pain the last couple of years. And I think the way that we need to think about this is we're thinking about phones nowadays like phones used to be back in the 90s. And it's not that way anymore. Your phone is not a phone. Your phone is a mini computer.
Absolutely.
It does everything that you can do on a computer on your phone. So if we think about that, an old school phone, there was no screen. You're holding it up to your ear. There were other issues with how you're holding your phone like this. With this, though, it's the same thing. We've got to keep that center of our nose right where the screen is. Otherwise, we're going to cause issues with our neck. But you get into the same issue if you're just texting like this all the time. We're going to have an issue with either the ergonomics of our shoulders or with our neck. So the best thing you can do is try to keep the screen up, because they create a whole condition called text neck just from doing and using your phones improperly.
Wow.
So keeping that up will at least help prevent that text neck, but also just taking breaks. What I always tell people is, if you cannot get the ergonomics perfect, that's okay. Any change is better than nothing. But with the phone, just put it down, stand up, stretch a little bit. You'll reset your center, because your body will start to tell you when it's becoming a problem. You'll start to get a little bit of neck cramp or ache. So if you're on your phone and your neck starts to bother you, put it down.
That's the key. Yep. That's the key that you need to listen to say, okay, I need a break, get outside, get some sunshine, soak in some vitamin D, take a break from the phone, and then you can go back to it. But yeah, absolutely. And I can believe this actually, with regards to the text neck, like actually naming that, because it was only a matter of time before that was actually going to come to surface.
Yep.
So finishing on that, with regards to teenagers as well. So now we're all getting phones at younger ages, right? Kids who are kind of in their early teens, or maybe they're even tweens, and they've got their phones. And I know the suggestion is for them to have it right in front of them. And I mean, so are you seeing things with people at younger ages that are having these text neck problems?
Yeah,
Wow.
it's been quite interesting last couple of years. Usually, what I used to see when we, like, let's say someone came in with neck pain, we took an X-ray, and we'd
Hmm.
see reverse curve or signs of osteoarthritis or degeneration. I've started to see that in teenagers, which is
Mm.
just crazy, because when you talk about arthritis, it takes years to set in. So this means that they've had something abnormally positioning, changing the center of gravity or their movement for years, and it can be tied back to the phones. Um,
Wow.
so that it really is becoming a bigger issue. So what I tell patients when they come in, if they've got kids or if they are a teenager themselves, say, listen, you've got to understand that now if you're having this issue right now at 15, what's it going to look like when you're 45 if you don't do something about it?
Exactly, exactly. And that is such a huge concern. And I really think that taking those breaks and making sure that you have good posture with everything else you're doing, and obviously, throwing some physical exercise in there too, that's really important for prevention. Yeah.
Yeah.
And so talking about exercise, athletes, it must be a huge part of your business. I feel like Kairos keep me put back together, right? After I do things to myself. And so let's talk a little bit about that, because I know with regards to the mentality of a lot of athletes, especially people who are competing and things like that, we're not always listening to our bodies, which can be a detriment.
Yes. So what happens a lot of times is, and we're not necessarily talking about, your professional athletes, but your
Mhm.
semi-professional
Yep.
or people who are just very, very active.
Hmm.
What happens is that you get into a point to where we have these little minor injuries pop up. So you start getting some pain here, you feel like you pulled something, but you don't stop what you're doing.
Right.
So what's interesting is that your body is going to do whatever it can to not be in pain. So what it does then, when you're still doing that same exercise, it's going to change your movement patterns and biomechanics to take pressure off that injured area, whether it's a muscle, tendon, ligament, joint, disc, whatever it might be. So you're changing your movement patterns now. Now, the reason this is a problem is now what you're doing is you're strengthening your body to move a way that it's not designed to move. So what's going to happen is now when you start going and you're lifting, you're squatting, you're going for your maxes, you are not using your body up to its 100% maximum, and actually you're using it abnormally. So you're more prone to have those injuries that come on.
Yeah.
And what I'm seeing is when the people come in with these injuries, these athletes have these injuries, most of the time, I'd say a very high percentage of it, when we
Mhm.
start going into their history and digging up, we can trace it back to one instance that it happened and they didn't think anything of it and they just kept going and going.
Mhm.
And so what happens though is the problem is now that they've gotten this compensatory mode and they've changed their muscle memory and their biomechanics, what we have to do is now we not only have to work on the injured area, but we have to retrain them to move properly, because
Yeah.
that abnormal movement pattern that creates abnormal stress and pressure over the joints and especially the disc too. And that is where the degeneration starts. So
Yeah.
we've got to stop that before we get into that issue years later.
Yeah, absolutely. And so what are some of the most common problems that you see with regards to just activity people are doing, some of the common ones that they're dealing with?
So one of the biggest injuries is going to be a bending, lifting type injuries.
Yeah, okay, that makes total sense.
And a lot of times it happens not only when they're working out, but even doing things like gardening. What I find is that, especially when it starts to get, the weather gets a little bit nicer,
Yeah.
people go out and they do things they have not been doing for months. They don't ration their activity. They just kind of hit it full blown.
Yeah.
A lot of people are not stretching. I'm really surprised at the amount of people who work out and they do not stretch properly or don't
Yeah.
know how to stretch. So we've got to talk about that too. And then a lot of times too, we're talking about injuries with things above the head. So lifting things like this,
Yep.
because what happens with that is, again, anytime you're putting weight away from your body or above your head, you're going to be shifting where your center of gravity is,
Mm-hmm.
which means that your body's going to be shifting how it's holding the weight. So again, if we've got an uneven base or a problem with the functionality of your body, you're going to be more prone to it.
Yeah, that makes total sense. And, that gardening thing really resonates because, as much as I train, I do live in the country. And it's funny because usually you're trying to fit gardening in. It's like, oh, I have all day Saturday. And you garden for instead of going out and doing a little bit and taking a break, right? Just like your phone, you go out and you garden for 8 hours. And then you get up the next day and think, what have I done to myself?
Yeah.
And that's so common. Yeah. And so what's with the athlete issues that you talked about, how do you make sure they heal properly? What are some of the processes that you use, that you teach them with regards to just making sure that they heal properly and then stay that way?
So that's the biggest thing. So the first thing is we have to identify what the issue is, because where they feel pain might not be where the problem area actually is coming from. It could be that the reason they feel pain on the right side is because that's compensating for the issue on the left that's not moving properly. So we've got to identify what it is, whether it's a bone, disc, ligament, muscle, and then we can kind of start going from there. The first thing that we always have to do when we have an injury is we have to make sure that we don't get scar tissue staying in the area. Anytime you have any kind of injury, even if it's a workout, is technically an injury. You're tearing muscle fibers. Your body uses immature collagen, which is scar tissue, to repair that. But if you're moving properly, it matures and now you get stronger. But the same thing happens if you go to the gym, you do a bicep curl, and then you wrap your arm like this for 3 weeks. That's never going to change in a normal muscle, and you're actually going to end up being weaker because you've got scar tissue there. Yeah. So we got to make sure that scar tissue isn't there. And then we start retraining the normal biomechanics, normal gait patterns, normal movement patterns, walking patterns, normal movement that they're doing when they're working out or with whatever exercise it is. And then the key, and this is really where the key comes in, and it really relies a lot on the person or the patient, is we have to start slowly retraining, but we have to do it at a slow pace. A lot of people want to get back and just go back to whatever their normal routine was. The problem is, though, especially when we've had injuries that have been there for a while, certain muscle groups have not been utilized properly, so they're weaker. Yeah. So you have to build those up, and they'll build up quicker than your normal workout. It took you years to get to a certain place. They'll build up quickly, but the problem is if you do too much too quick, you fall back into the abnormal movement pattern because that's where your body's the strongest, and you're going to cause a new injury to come back. That's usually what happens when people have a re-aggravation that I've seen. It's either A, they did too much too quick, or they stopped doing their stretching like I told them. Yes. So those are the two main things.
The homework.
Yes.
The homework is the most important part, right?
It is.
It's like you don't make the gains at the gym, you make the gains doing your recovery. Correct. Right? Same type of idea. And I do agree. I think that one of the biggest things is people going back too fast. And that's usually, even with my experience with people who are lifting, that's usually part of the problem is they just tried to do it a little bit too quick and didn't actually give their body the right time that it needed to be able to retrain those normal patterns to actually be strong again. Yeah. And so kind of getting us into our next topic, because of course, I know, for me, I want to live to be of old age, but I also want to live to be of old age and be active, right? I want to be able to age gracefully. And so I'm always curious, just with regards to longevity, you see some people who are 90 years old and, they're in a wheelchair and they've got a lot of issues. And then you see other people who are 90 and, they might still be playing tennis every day or golfing every day. And so let's talk about that. Let's talk about aging gracefully and kind of what your take is on that with regards to body mechanics.
Yeah. And it really all comes down to movement. We want everything to be moving properly. And it's really interesting. I see that when I see patients who are a little bit older and they've had issues going on for years, the first thing they tell me is, oh, well, I can't do this anymore and I can't do this anymore. And my question to them is, are you okay with cutting more and more out of your life? Or do you want to try to get back to where you should be and doing what you want to do? Because that's going to be the trade-off. If your body doesn't heal the right way, there's going to be less things you can do because your body physically can't do it. Yeah. When you have arthritis eventually goes and it fuses vertebra together. When it fuses, there's no motion back. And then when we have discs that are slowly deteriorating, when they become bone on bone, you're not getting that disc back. It's gone. And that's why you see like the people who go in and they get fusion surgeries, they've lost the motion segment forever at those places. So once you lose it, it's gone. So we want to make sure we don't get to that portion. Now, the good thing about that is it doesn't happen overnight. It takes years to actually degenerate to the portion or to the point to where it's permanent. So it's all about making sure that you do the right things as quickly as possible, because the quicker you do it, the quicker you get results and you get back to where you should be. But on the other hand, too, is if you're not taking care of your body and now you're in your 60s, 70s, and you haven't been taking care of your body for 50 years, there's no way you're going to feel like you're 20 again. It's just, it's physically impossible. While there might be some improvement that can be done, we can't undo all of that. So it's really taking care of your body. And when you notice these things, either get it checked out or do something about it. Don't just say, oh, I'm just going to put this off or I'm going to work through it, because it has that long-term effect. So all these people, when we talk about the working from home improperly, or the kids on the cell phones, or the athletes getting injured, when we're not doing anything about it now, it's going to come up later in life, but it's going to be a much bigger issue. It's going to be much harder to get any good results. So it all comes back to motion. That's the thing. You have to move properly. And if you can't move, turn, or bend either as much as you should or without pain, then there's a problem.
Absolutely. And so what are, daily movement practice? I preach that all the time. I feel like I'm always saying that to people. And it doesn't mean that you have to do high intensity training at the gym 7 days a week, right? When we talk about movement, it can be going for a walk. It can be doing yoga, which is including all of that stretching that's really healthy for us and necessary, which a lot of athletes skip, right? We just have enough time to do our training, but we don't have time to do the accessory work, which sometimes is the most important part. And so with that daily movement practice, what are some of the kind of top suggestions that you may give to someone who is looking at including movement daily in their practice to be able to age gracefully?
The first thing is starting with just your normal movements. So, we want to set up a thing for not only low back, but for neck, for middle back, for shoulders. And just it's kind of like, when you are working on any kind of like a car or something like that, you got to make sure it does its normal motion. So with your neck, we got to do an extension, we got to do a flexion, a side to side. So because if by doing that normal motion without any kind of resistance is painful, we can't move to the next stretching yet.
Right.
So first is making sure we do that. A lot of issues just come up from neglect, really. It's neglect of your normal biomechanics and movement. Same thing when you see an old piece of metal that gets rusty, it's because it wasn't taken care of. The joints are the same way. If they're not taken care of, that's where we start losing movement. So it's the normal things. When you get out of bed, first thing in the morning is a great time to actually do some stretching, go through your normal motions. And then also another great time is before you go to sleep too. Because when you're sleeping is when you can get yourself into some interesting positions and you can't really control what you're doing. But if we can get it when the muscles are moving, we can get them malleable, flexible, get the blood flowing to them. That's what promotes healing. So it's all about getting that normal motion. So start with just the normal movements, and then you can kind of graduate from there. We just want to be very careful. I never start anyone off on any kind of stretching routine without seeing what their issue is, because I'd rather them do nothing than something that could potentially injure themselves.
100%. Yes.
So
absolutely.
It's always, what I always say is, it's great to start, but if you feel pain, listen to your body and stop. Yeah. That means that you can't do that, and that's okay. You're not there yet. It means you just need to work from there. So everyone is going to have a different starting point, but it's all about finding out where you're at. Someone might wake up and find out, hey, they can't bend over and touch down to their knees because they're so stiff. That's okay. That just means we need to work on that, and that's showing you that maybe needs more attention.
Mm-hmm. Well, and I feel too, so a couple things is I always think about when my dog gets out of bed in the morning, because I have a tiny little Chihuahua and he always does a big, huge stretch when he gets out of bed in the morning. I'm like, I should be doing that. As you mentioned that in the morning, I'm like, he does that every single morning before he goes outside. But with regards to just joints and losing that joint mobility, and that's really true because as we age, and for me personally, I have advanced arthritis in my big toes. And I remember back when I was, oh my gosh, probably 15 years ago, I went to a sports clinic And when they x-rayed my feet, they actually they actually told me that I should do movements that didn't allow my toes to bend anymore. And I was like, that is the last thing I'm going to do. Right. So it was like, I need to make sure that I move these as much as possible, because I don't want to lose that with regards to what's happening. Right. So I think that's really important. And I also think that sometimes people, depending on their age, right? You know, when we're in our 30s, 40s, 50s, we kind of get into that age where we may be losing a little bit of that mobility if we're really not working on it. And I feel like sometimes people feel like it's never going to come back, right? So they get to that point where they're like, it's never going to come back, so why would I do it anyways? But that's just simply not true. I feel like when you find that starting point and you work at it, you can definitely gain mobility. I feel at any age, if you put enough effort into it and you do it the right way.
Well, and you know, the argument I always give them too is that they say it won't get any better. I say, okay, but are you okay with it getting worse? Because if you don't do anything, you're going to continue down the same pattern you are. Exactly. So even if you can't get better, we cannot, under any circumstances, have it get worse.
Yeah. Yeah, absolutely. I agree 110%. And so with regards to kind of that healing for good, one of the interesting things, and we talked about movement, I want to just kind of backtrack a little bit because I thought about this when you were talking about it, is the neck. Because as a coach, I've had lots of different people tell me different things over the course of the years. And so with regards to the neck movement, side to side, front to back, head circles, right? Moving your neck in a circle, that is a big no-no for some people. So tell me your opinion, and then give me a little background as to why, because I'm just curious with regards to that.
So you have to be careful. And the reason that they say that is that, again, when we're recommending something like that, we have to recommend something that's safe for the majority of people.
Yeah.
And safe meaning that it's not going to cause major issues. Yeah. So neck circles, they're problematic for a couple different reasons. I can't remember the last time I've recommended to do neck circles for patients, because we're combining different motions in one. So whenever you do that, there's a higher chance for error. And I like to try to stick with things that, you know, people aren't going to mess up, because when they mess them up too, then they become discouraged, and now we're going back into that negative emotion cycle. So we don't want that. The other problem is depending on what they have going on, whether they have, let's say they have an issue with a clogged artery, to where now we're putting them in a position to where this artery is clogged, they go in the next circle, now they're occluding this artery, now we could have a stroke. So that's
interesting.
So
okay.
that's one reason, especially in the older population, you have to be very careful with that. Yeah. But the other thing too is that depending on what's going on with the surrounding musculature, putting them in that position, let's say they have a herniated disc, could put pressure on the nerve, and now they get numbness tingling down their arm, and we're causing, more pain. So sticking with the normal movements is easier instead of combining, because you're also utilizing more muscle groups. So again, you're more likely to hit a problem with that movement pattern. Yeah, so it's kind of about decreasing the chance of causing an issue or exacerbating symptoms.
Makes total sense. And so let's talk about your practice. So you're obviously in Downs Grove, yes, and you work with all types of people, athletes, elderly, kids. The teenager thing really does scare me with the text neck. I'm really scared with regards to that population. And I really hope that, they take their posture and their health really seriously, because again, as we age, we definitely want to do it with the best posture possible and with the most movement practice. And so let's just talk about your practice and how they can get in touch with you to work with you if they're in your area.
Sure. So going back to everything we talked about with movement, that's how I've kind of focused my practice around, so we can actually get the movement back. But I also like to focus on actually starting with a legitimate diagnosis, instead of just saying, neck pain or back pain. Let's find out what's causing the pain, because then it tells us what we need to do to restore that motion and that movement in the area. So we use a combination of chiropractic, massage, physiotherapy, physical therapy, strengthening, stretching. It just all depends specifically on where the person is, what their condition is, and what they're able to do. But the goal is that we kind of start them out by, the first thing is we always want to start reducing pain and inflammation and swelling. Then we want to start restoring the ranges of motion, because you have three. You have active, passive, and joint. All three have to be restored or as close as possible. Otherwise, we're going to have that abnormal biomechanics.
Yeah.
So once we're able to do that, now we start strengthening up the body to hold that position. So what I like to tell patients is we don't necessarily get to the strengthening gym stuff, but what we do is we work on postural strengthening. I need you to be strong to be able to sit at your desk all day, every day, without having any issues with your neck or your back, or go and do your job or take care of your kids or whatever it might be that was your limitation. We need you to be able to do that, because once we can do that, then we can just start building and building. But it's all about those small steps. One thing I found too that's really interesting, especially in patients either after accident injuries, whiplash type things, or with chronic issues, is one thing that they have going on is ligament issues. So we've got ligaments that go down the front and the back of our spine, and what happens is that those ligaments are responsible for helping keep that joint in motion, so everything moves as one motor unit. But when one becomes damaged, injured, or overstretched, now it's like a loose rubber band, and it doesn't have that protection. So your body starts compensating by using the muscles to do the ligaments job. So the muscles are overworked. So now we're building up scar tissue over time because they're being overworked. You've got abnormal movement patterns, so those don't heal the right way. So diagnosing that and finding out exactly which motion it is it flexion, extension, is it lateral bending, where's the ligament injured at, and then we can start devising a way to get that ligament to heal. And that is how we actually are able to get the results that we do and the results that last. So this way it's not, we're going to see you again in 3 months. It's, I shouldn't see you again unless you re-injure yourself with something totally new. And that's really kind of changed the way we do things, because we can get results with these cases that before we couldn't, or have been to multiple other therapists. And it all starts with that diagnosis. And the root problem was never gotten to. They were working on symptoms. And symptoms are okay because you feel better, but it comes back. And we're doing this over and over and over again. And that's kind of what we don't want. So we start by doing that. We do detailed x-rays so we can actually look at these ligament instability issues if they're present. And there's different degrees and grades. So we really just want to make sure we're very detailed about it. And then we can come up with the best plan for that specific individual, getting them the results that they want.
Yeah. And so the one thing that really resonated with me with regards to that particular focus in your practice was two things. Is that one, when it comes to the body and a symptom, it almost is never where the symptom is that's the problem. Right? Someone will say, oh, my shoulder's sore. Okay, well, what about your trap? What about your rhomboid? What about your forearm, right? There's a lot of outstanding areas that may have problems that are actually causing that pull or that pain or that throbbing or whatever the case might be. And the next part is with regards to getting to the root cause. Because you're right. It's the same with your gut health, your, whatever's going on inside your body. If you don't get to the true root cause and figure out what that is, you're never going to truly be healthy for the long term, right? And so that is a really innovative and forward-thinking way to do what you do. And I think that's pretty incredible. So if you are in the Downs Grove area, I think you would be absolutely crazy not to take advantage of the fact that Dr. DeCubellis is there and running this amazing practice. So we'll have some contact information in the last slide of how you can get in touch with the clinic. And as always, if you have any questions, I'll include his email as well as my own. You can let us know. And I really hoped that you enjoyed this episode. And I hope that the next time you pick up your cell phone to text and sit on the couch with your laptop, you think about this, because, take those breaks. Get out, do some movement, right? Daily movement practice, so important for longevity and to age gracefully. So if you enjoyed this episode, which I really hope that you did, give us a thumbs up. If you're on YouTube, make sure you subscribe to my channel. There's a brand new episode every 2 weeks, and we will see you next time. Thanks for listening to today's show. Head over to Pitel-Killah.com to gain access to some amazing free resources that will help you gain energy, erase debilitating symptoms, and be the best version of you. Remember to give this podcast a like and follow me on social media at Lisa Pitel-Killah. I'm here every 2 weeks with a brand new episode of the Human Optimization Podcast. Until next time.